咁其實如果有性功能障礙嘅患者，佢有啲乜嘢方法可以醫治呢？咁究竟坊間嘅口服藥同埋坊間嘅針劑療程，其實係咪真係咁好效果呢？咁我哋今日好榮幸邀請到中文大學內科及藥物治療學系湯連信教授上嚟為我哋講解下性功能障礙藥物嘅治療方法。Professor Brian Thomason, please.
Good afternoon, ladies and gentlemen. I'm sorry I'm going to have to speak to you in English, but fortunately we have Roy here to translate into Cantonese.
各位午安，今日唔好意思，我要同英文同你 present， 但係我會幫你做翻譯嘅。
So as you see, I come from the Department of Medicine. In fact, I'm a clinical pharmacologist, and I'm going to focus on some aspects of the medication for the treatment of erectile dysfunction. And Norman Chan has already given some introduction on this.
今日我會同大家講下一啲醫療陽痿嘅藥物，同埋頭先阿陳醫生已經同我哋解釋咗少少啦。
First of all, we should consider what we mean by erectile dysfunction, what is the definition. And you can see here that according to the National Institute of Health in the United States, they say it's a repeated inability to get or keep an erection firm enough for sexual intercourse. And the causes can be divided simply into psychogenic or organic, or often a mixture of the two, psychogenic and organic. And the risk factors for erectile dysfunction, again, you've heard very much from Dr. Norman Chan already that diabetes is one of the major problems which results in erectile dysfunction, and it's becoming increasingly common here in Hong Kong. And in addition, hypertension, high cholesterol, various types of coronary heart disease, smoking and obesity. All of these things are very common risk factors for erectile dysfunction.
首先，我哋要定義咩為之陽痿同埋佢嘅成因啦。美國國家衛生研究所將陽痿定義為重複無法得到或者維持一個足夠硬度嘅勃起去進行一個性行為嘅。勃起障礙有好多個成因，大致上可以分為生理、心理或者兩樣加埋。生理嘅包括神經線同埋血管出現咗問題啦，荷爾蒙唔足夠啦，或者藥物治療帶來嘅一啲影響，例如高血壓藥物咁樣。香港同其他先進國家都係一樣嘅，都會有好多一啲潛在嘅因素影響到有勃起嘅障礙。同陳醫生之前所講一樣啦，糖尿病係一個非常重要誘發勃起功能障礙嘅成因。有好多年長嘅糖尿病患者都會有陽痿嘅，有部分係因為血液供應唔夠或者神經受損所致嘅。
Now, again, Dr. Norman Chan has already described to you the mechanisms of penile erection and erectile dysfunction, and I'll just go over this again fairly quickly with this diagram. The diagram here shows the arteries bringing blood into the penis and the veins which drain the blood out again, and shown in yellow here are the nerves supplying the penis. And these two cross sections here coming from that area show the penis in the flaccid state and the erect state, and the mechanism of erection involves a relaxation in the smooth muscles which surround these blood-filled spaces called trabecular spaces, and also dilatation of the arteries. So in the erect state, the penis looks like this with the sinusoidal spaces filled with blood, the arteries dilated, and this in turn compresses the veins which drain the blood out. So that again tends to increase the degree of erection.
呢張圖就顯示咗供應血液嘅動脈同埋血液流出嘅靜脈，黃色嘅就係神經線嚟嘅， 動脈或者神經線受損呢，就會導致陽痿啦。呢兩張海綿體嘅橫切面就顯示咗勃起嘅機制。喺靜止嘅狀態時候呢，收縮嘅平滑肌將動脈壓住，限制咗血流。勃起嘅時候，動脈擴張令到陰莖入邊嘅空間膨脹，同時將靜脈壓住，減少血液流出。
Now, if we look at the underlying molecular mechanisms of penile erection, we can understand why certain medications will be effective. This diagram shows a smooth muscle cell from inside the penis, and you can see there are various nerves which act on the smooth muscles, and they have different effects. The sympathetic nerves release adrenaline or noradrenaline, and this stimulates alpha receptors on the surface of the cells to cause contraction. There are also cholinergic nerves which release acetylcholine, and they may facilitate the release of a chemical mediator from the endothelial cells called nitric oxide. Nitric oxide is also released from some other nerve endings directly. And the nitric oxide has an effect to activate an enzyme here in the smooth muscle cell called guanylate cyclase, which produces cyclic AMP, or cyclic GMP down here. Up there we have cyclic AMP, which is stimulated by adenyl cyclase. This in turn is stimulated by certain prostaglandins, prostaglandin E1, so that increases in the cyclic AMP and cyclic GMP promote relaxation of the smooth muscle, and this is the major mechanism of penile erection.
呢一張圖呢，就用咗一個分子嘅層面去了解勃起嘅機制。唔同嘅神經線有唔同嘅效應。Sympathetic 嘅神經線會釋放 noradrenaline 去刺激 alpha receptors， 令到肌肉收縮。Cholinergic 嘅神經線會釋放 acetylcholine， 令到內皮細胞嘅 nitric oxide 增加。其他嘅神經線會釋放訊息，叫平滑肌增加 cGMP。同時 prostaglandin E1 亦都會令 adenyl cyclase 增加 CAMP， 而 CAMP 同 cGMP 一齊嘅增加會令到平滑肌放鬆。其實有好多方法可以幫助勃起嘅，例如壓制 alpha receptors 啦，同埋減少 cGMP 同 CAMP 嘅分解。
Now, as you've heard already, there are various different treatment options for erectile dysfunction. And one might consider, first of all, certain oral medications. And then there are injection therapies. And I'm going to focus particularly on a mixture of 3 medications called Trimix. You've heard already that there is a preparation which can be administered in the transurethral route called alprostadil. There are various physical means of treatment, such as a vacuum pump, or in really difficult cases, one may have to resort to surgical treatment with implants of various devices, or perhaps surgery to improve the vascular supply. And of course, we must not forget that many patients will need psychosexual therapy, so that is still a very important consideration in quite a lot of patients, but I am going to focus very much in this talk on the injection therapy with Trimix.
勃起障礙有好多唔同嘅方法可以治療嘅，包括口服藥物啦，或者將藥物直接注射入陰莖或者尿道，抑或一啲真空泵同埋一啲人工植入嘅手術。對部分嘅病人嚟講呢，性心理治療呢係其中一個好好嘅選擇。但係今日我將會集中討論嘅係 Trimix 3P 混合劑。
So, considering the oral medications, I think most people are familiar with the medication sildenafil or Viagra. It's become very widely known in recent years and very commonly used. And there are two other very similar treatments. Again, Dr. Norman Chan described these and how quickly they work, how long they go on working. So there's tadalafil or Cialis and vardenafil or Levitra. So these are the three medications which are phosphodiesterase type 5 inhibitors. In fact, in medical practice, these medicines also have been found to be useful in the treatment of pulmonary hypertension, a peculiar condition affecting the blood supply to the lungs. But again, because these are taken orally and they affect all of the body, one might anticipate there will be some adverse effects. And perhaps the commonest adverse effect will be headache, and then maybe flushing, nasal congestion, and again there are other things like muscle pain and backache. But perhaps it's more important to consider that there may be serious cardiovascular events, and patients with heart disease sometimes are taking medications called nitrates, and these interact quite strongly with this group of medications and may cause severe lowering of blood pressure and sometimes loss of consciousness. So that's a very important thing to think about for patients who may be using these types of medication. And the other medication to mention at this stage are the androgens, particularly the male hormone testosterone. In some patients with erectile dysfunction, this hormone may be insufficient. They may not be making enough of the hormone themselves, and in that situation, it would be appropriate to replace it. And it can be given as an oral medication, or again, as you heard in the previous talk, it can be given by injection, and indeed there are some other preparations which are put on topically.
對於公眾嚟講呢，口服藥物好似偉兒剛，俗稱偉哥啦，比較多人熟悉嘅。另外有兩種藥物就係西利士同埋納威大，佢哋嘅分別就係藥效嘅時間長短。呢啲口服藥物都係可以減少 cGMP 嘅分解嘅，從而令到平滑肌放鬆。口服藥物設計嘅時候呢係針對陰莖嘅，但係因為佢係用口服食嘅關係啦，佢哋會對身體其他部分有副作用嘅，而呢個情況亦都係好普遍。普遍嘅副作用包括頭痛啦、面部充血啦，同埋鼻塞嘅。呢種藥物對有心臟病嘅人係會有影響嘅，因為心臟病嘅人一般都會食用一隻叫做硝酸鹽嘅藥物，同時服用呢兩隻藥物呢，就有機會令到血壓過低同埋失去知覺嘅機會。仲有一個影響勃起嘅重要因素就係男性荷爾蒙啦。如果經過檢查後發現男性荷爾蒙唔足夠嘅時候呢，就可以選擇食用一啲口服藥物啊、搽藥膏啦，或者用針劑注射嘅。
For the medications that are given by direct intracavernal injection, it has been found that using a combination of 3 different medications, which is called Trimix, this one called Trimix, seems to have the best balance between beneficial effects and adverse effects by using this combination of 3 medications. And I'm going to describe this by describing certain clinical studies with this mixture of 3 medications, and I'll talk a little bit about the adverse effects and complications that may occur.
有發現就指呢，混合咗3隻唔同嘅藥物叫做 Trimix， 注射咗入去海綿體入邊呢，可以達到一個協同嘅效果嘅，同埋將副作用減到最少。我而家就會同大家分享一啲臨床嘅醫學報告。呢一啲臨床嘅醫學報告就分析咗呢個 Trimix 嘅好處同埋會產生嘅一些副作用嘅。
So the intracavernosal injection has to be administered very carefully into the penis directly. This is an alternative to oral medications, and the Trimix preparation is a combination of 3 different medications combined together in the one injection.
Trimix 係要小心咁樣注入去海綿體入邊嘅，咁樣可以令到藥力集中喺注射嘅部位，對身體其他部分嘅副作用減少。 Trimix 係3種藥物混合而成嘅，佢哋分別就係 Prostaglandin E1 同埋 Phentolamine。
So let me explain what these 3 different medications are. Piperine is a medication which has been used for a long time to treat erectile dysfunction. It causes the smooth muscle in the penis to relax and allows the sinusoidal spaces to fill up with blood. When it's used by itself, it has a relatively high side effect profile. It may cause various side effects, and so it's better to combine it with other medications in smaller doses. The second one is the prostaglandin E2. This is marketed in certain preparations which have approval by some regulatory authorities to use as single therapy. It again acts as a smooth muscle relaxant. It's injected in the same way, and it was the first one to be approved by the American Food and Drug Administration. The third medication is called Phentolamine. This is a medication which inhibits the alpha receptors. It's an alpha receptor antagonist, so it reduces the effects of noradrenaline, which are vasoconstrictory, and it will increase the nitric oxide supply, and again it works by inhibiting the signals from the adrenergic nerves. So these 3 together are used in the Trimix preparation.
Piperine 係第一隻用嚟注射嘅藥物，佢係一種抑制劑，可以減少 cGMP 同 cAMP 嘅分解。高劑量嘅 Piperine 呢十分有效嘅，但係同時副作用亦都較多，所以係需要混合使用嘅。Prostaglandin E1 可以令到平滑肌肉放鬆，佢係可以單獨使用嘅，而美國嘅 FDA 呢亦都係認可咗呢隻藥物去醫療陽痿嘅。但係淨係用呢隻藥物嘅成效就唔係好顯著。第3隻藥物就係 Phentolamine， 佢能夠抑制 noradrenaline 同埋 alpha receptors， 阻止肌肉嘅收縮。將呢三隻藥物混合調配，可以達到一個協同嘅效應，同埋將副作用減到最低嘅。
Now, I'll show you the benefits of this mixture in the next few slides. This slide shows a clinical study in 625 patients with erectile dysfunction. They were treated with different types of direct injection, starting with 1 drug and moving on to 2 and then 3. And you can see here those that just received the single medication with prostaglandin E1, about a third of them get a satisfactory erectile response, but there's quite a high proportion of side effects. The side effect is pain at the site of injection. When a combination of 2 medications are given together, the result is better, and in fact, by combining the medications, the side effect becomes less because they're using smaller doses of each. And in fact, using the combination of 3 medications in the preparation called Trimix, 94% of patients could achieve satisfactory erection. And again, the side effect of pain was very infrequent by using this combination.
喺呢個臨床測試入邊呢，有625個陽痿病人分別接受咗唔同劑量混合而成嘅藥物治療。有病人對 prostaglandin E1 有反應，但係當 prostaglandin E1 嘅量增加嘅時候呢，同時亦都出現咗一啲副作用。但係將藥物混合一齊使用嘅時候，效果就好顯著啦，副作用亦都比較少咗。總括嚟講，有超過90% 嘅人對 Trimix 呢隻藥係有正面嘅反應嘅。
Now, it may be interesting to consider how we should manage older patients with erectile dysfunction. And this study in elderly patients looked at 300 patients with erectile dysfunction. The average age was 67, but it extended up to 85, so some of these patients were quite elderly. And you can see it's a comparison of using the prostaglandin E2 by itself, and in these patients about 48% had satisfactory response, but 11% had the side effect of localized pain, whereas with the Trimix, the 3 medications mixed together, about 3/4 of the patient have a satisfactory response, and again the side effect of pain is less frequent. So the treatment appeared very effective in these elderly patients who have organic impotence.
喺另外一個測試入邊，有300個平均年齡係67歲嘅人呢，最大嗰個係85歲。佢哋因為一啲生理嘅因素而引致到有陽痿嘅。呢300個人入邊分別接受咗 prostaglandin E1 或者 Trimix 嘅療程。48% 接受咗 prostaglandin 嘅人有正面嘅反應，但係同時亦都有11% 嘅人感到痛楚。而 Trimix 就對75% 嘅人有效，同時注射嘅位置感到痛楚嘅呢係較少嘅。
Now this is a study in patients who had developed cardiovascular disease of the heart, or some of them had also had stroke. And these patients, after developing these cardiovascular diseases, developed erectile dysfunction. And they were initially treated with sildenafil, Viagra, to see if they responded. And as I mentioned, that needs to be done very carefully in these patients because they may have adverse reactions. But there were 113 patients who had no satisfactory response to sildenafil, and they were treated with the intracavernosal injection of Trimix. And you can see out of those patients who are not responding well to sildenafil, 3/4 of them have a positive response to Trimix. So a very good overall response. And the side effects seen here are quite uncommon. Priapism, or prolonged erection, occurred in about 7%. Small nodules at the site of injection, around 6%. And bruising occurred in about 8% here. And that's partly because some of these patients are taking an anticoagulant drug called warfarin. So Trimix seems to be very effective in patients who have underlying cardiovascular disease who don't respond very well to sildenafil.
呢張幻燈片就顯示咗一啲心血管疾病引致陽痿嘅病人對 Trimix 嘅反應。呢啲人曾經有過心臟病啦、中過風啦，或者出現過心臟病嘅病徵。呢一組人係比較難治療嘅，因為陽痿藥物對佢哋嘅副作用可以引嚟好大嘅後果。喺呢113個對口服藥物冇反應嘅人入邊佢哋就轉咗去用 Trimix。而呢一組人入邊用咗 Trimix 之後，有3/4嘅病人就對 Trimix 嘅效果感到滿意嘅。有少數嘅人士感到勃起過久啦、注射位置結啦同埋瘀傷。瘀傷嘅病人係通常因為食咗呢個 warfarin， 所以令到會有瘀傷嘅。
This slide describes another study in patients who were already established on the Trimix injections. They were invited to try the oral sildenafil as an alternative, and quite a large proportion, 52 out of the 69, did show positive responses. So they had a response with the oral medication, but when they were asked which they preferred, about 3/4 of those who actually responded to the sildenafil still preferred to have the injection because they found that it gave a better, more reliable and a more rapid onset of erection. So overall there seemed to be an advantage to these patients to continue to use the injection treatment. And in fact, another advantage that was noticed was that these patients also started to develop spontaneous erection more frequently when they were treated with Trimix.
咁樣喺另外一個測試入邊接受咗 Trimix 療程多過1年嘅人就轉咗去食口服藥物。 喺呢啲人入邊，75% 嘅人對口服藥物係有反應嘅，但係有74% 嘅人覺得 Trimix 係比較好，因為佢俾到佢哋比較好嘅勃起質素，同埋勃起所需要嘅時間係比較短。另外，針劑療程亦都增加咗自發性勃起嘅次數。
This is another study in 189 patients with functional erectile dysfunction. They had various underlying diseases, vascular disease, diabetes, and neurological disease. These are common causes of erectile dysfunction. These patients were given Trimix treatment over a period of time, and you can see 92% had a positive response. So the response really was very encouraging here. Very high percentage have this response. And in addition, over 7% also develop spontaneous erection. So they seem to have an improvement in their erectile dysfunction over a period of time. The other side effects that occur are some localized fibrosis at the site of injection and the prolonged erection or priapism. So overall, the Trimix injections were very effective in this group of mixed patients, and quite a large proportion do regain spontaneous erection.
喺189個因唔同因素引致陽痿嘅病人入邊呢，佢哋接受咗 Trimix 之後有良好嘅反應，其中有7% 嘅人回復翻自發性嘅勃起，有一少數嘅人士感受到勃起過久或者注射嘅位置有結拉嘅現象出現。
So if we think about the adverse effects of this form of treatment, perhaps one worrying problem will be pain at the site of injection. This is particularly common if we use the prostaglandin PGE1 by itself as monotherapy, and particularly if we use high doses of that. And so this problem can be minimized by using the combination of Trimix. Another problem that we always have to be cautious about is prolonged erection or priapism. We don't want the patient to have this problem going on too long. This can usually be avoided by very careful instruction and dose titration. And so it's really a problem that can be prevented by proper advice and care of the patient. The third problem is fibrosis, a sort of thickening of the tissue at the site of injection. This will occur in a certain proportion of people, depending on what drugs are used and how it's been used. It has been a problem if papaverine is used by itself. And so again, it can be limited with proper injection training and the use of the combination treatment. And lastly, in a small proportion of patients, there may be hemorrhage at the site of injection. And again, that can be limited by the proper training of the injection technique.
總括嚟說呢 Trimix 嘅正面效益係十分顯著嘅。當適當地混合3隻藥物，發生嘅副作用嘅機會率係減少嘅。當注射高劑量嘅 prostaglandin 嘅時候，注射嘅位置可能會感到唔舒服。如果將 prostaglandin 嘅份量減少，就可以減少情況發生啦。勃起過久亦都係另外一個會發生嘅現象，通常係因為藥量過多所致。只要小心調教，呢個情況係可以避免嘅。結拉呢個現象通常會喺高劑量嘅 papaverine 所引致，出血亦都會有機會發生嘅。但係只要經過適當嘅注射訓練，呢啲情況就可以避免啦。只要接受一個適當嘅注射訓練啦，同埋適當嘅混合劑量，就可以達到絕少嘅副作用，同埋患者可以得到最好嘅療效結果。
So overall, you can see that this injection of the 3 medications together called Trimix is very effective in relieving the erectile dysfunction, and the side effects are quite uncommon and can be largely reduced by proper training of the patients. So thank you for your attention.
多謝各位。Okay, the question is, what age group is suitable to use Trimix therapy? 咩年紀嘅人士咧係適合用呢個 Trimix 嘅治療咧？
Well, I suppose the simple answer to that is any age. There are really very few or almost no contraindications, and age in itself is not a contraindication. I've shown you data here in men up to the age of 85, and I think even 85 is not the oldest that we could use this medication in.
咁其實咧呢個治療咧同年齡係冇關嘅。頭先睇過一啲報告啦，咁最大年紀嗰個咧都係85歲嘅，咁85歲嘅人士都適合用呢個療程嘅。It is very costly to use Trimix therapy。就係 Trimix 呢個 therapy 係咪好昂貴嘅咧？
或者咁啦，嗰個問題我哋交翻俾陣間漢陽男士健康中心嘅負責人講解翻俾各位先生好冇？我哋稍後同你講翻，其實都唔係昂貴嘅。
I suppose the answer might be it should be worth it to the patient.
醫生覺得係值得嘅。How long does it take for the whole treatment？ 即係通常個療程係要幾耐嘅時間呢？
That's slightly difficult to answer in a way. The treatment works straight away, of course, when the patient is given the injection. Now, the patient will need some training, and this may take minutes or hours, depending how quickly the patient gets the idea of the procedure. And many patients will want to go on using the Trimix for several months or even years. So the answer is that it works very quickly straight away, but the whole process may go on for a very long time.
簡單嚟説啦，用咗呢個針劑療程之後咧，嗰個效果反應係好快嘅，可能幾分鐘就會有反應㗎啦。但係你至於用幾耐咧，就係睇下個用家想用幾耐啦。咁由幾個月啦到1年都不等嘅。
Thank you, Professor, for a very enlightening lecture. I would like to know what exactly is the technique that you will use to minimize the occurrence of fibrosis. And secondly, for patients on anticoagulants, can they still use Trimix? Thank you.
呢個問題就係問教授有啲咩方法可以防止結拉咧，同埋一啲防止血凝固嘅病人適唔適合用呢個藥物係嘛
My experience is in the way that medications work. I'm not an administrator of the medication, so I can't tell you exactly how the administration is perfected to avoid the fibrosis. Although, as I mentioned, one of the important things is having the right mixture of medications together. For instance, if one just uses high doses of Priapism, that's more likely to cause a fibrosis. So that's one aspect, and I think the team working in the company here would be better able to describe the techniques to avoid the fibrosis.
首先結拉呢個問題咧，主要嘅成因咧就係嗰個混合嘅方法嘅。咁如果混合得好嘅咧，呢個結拉嘅問題就會減少出現啦。
But your other question about the bruising, if there are patients on warfarin, that may well be a problem. Patients on warfarin, particularly if they're treated so that the anticoagulation is quite marked. If they have an INR which is perhaps nearer to 3 than to 2, they would be at some risk of hemorrhage. So that may be a problem. Of course, there are many other patients nowadays on other types of antiplatelet drugs, particularly aspirin and clopidogrel and the various other antiplatelet agents, and they may be at some increased risk of hemorrhage as well. But the problem is not so bad as with warfarin. So I think if one has patients who are on warfarin or other forms of total anticoagulation, low molecular heparin or other forms of heparin, I think one would have to be very cautious in using this technique.
係咁樣，如果一啲病人係用緊一啲防血凝固嘅藥物嘅病人用呢個針液嘅時候咧，就要好小心啦，因為會導致瘀傷嘅。
頭先想回應翻咧，阿 Doctor 係咪啊？佢個問題咧，或者我將你個問題轉達俾我哋嘅徐醫生 Dr. Daniel Choi， 係我哋漢陽男士健康中心嘅主診醫生咧，佢可以幫你答一答個問題嘅。
呢個Fibrosis 咧就唔係好常見嘅，但係有。但係我哋嘅辦法咧就係 rotate 輪流嘅地方打。你打死一度咧，佢有 Fibrosis 嘅機會高啲。你 rotate 下咧就少好多。而且我哋用嘅藥咧好少嘅，所以Fibrosis 機會唔同，唔係淨係用pure 嘅 Priapism。就另外咧。就流血咧，好似打其他針一樣嘅，肌肉都係 compression for a bit longer 我哋通常咧撳 3 minutes，maybe 如果你按 aspirin 啊、warfarin 啊，5 6 minutes 咁就好少有問題。
唔該晒徐醫生。啱啱頭先接到一個問答紙咧，就係關於 Trimix 嗰隻藥係可唔可以幫到早泄嘅患者咧
？Can Trimix help PE, premature ejaculation? One has to first of all consider that the nervous mechanism involved in ejaculation is not something that one would predict would be altered by the medications that are in Trimix, and that's probably why if you look at some publication describing the different treatments for premature ejaculation, Trimix may not appear there. But in fact, what happens in patients who are treated with Trimix, there are many who do find that there is an improvement in premature ejaculation. This has been published several times. And one might understand that because there is quite a strong association between erectile dysfunction and premature ejaculation. The two often go together. And so if one's treating the underlying problem of erectile dysfunction, then the premature ejaculation again can be improved. And one might perhaps understand that in various ways. Maybe in some patients with erectile dysfunction, using the Trimix sort of restores their confidence because it's such an effective treatment to overcome the erectile dysfunction. And then secondly, because the Trimix treatment produces an erection that lasts for quite a long time, and it doesn't immediately resolve after ejaculation. So it's possible for the patient to try intercourse a second time. So there are many ways by which using the Trimix does overcome the problem of erectile dysfunction.
好，唔該晒阿 Professor。咁或者阿 Roy 可唔可以翻譯？
好，咁首先咧Professor Thomas 所講咧就係呢個早泄嘅情況咧，好多時候因為神經線嘅敏感度啦，咁 Trimix 係唔會影響神經線嘅敏感度嘅，所以唔會有文獻，即係好少有文獻睇到 directly Trimix 同埋 PE 嘅 relationship 嘅，但係亦都有文獻寫咗出嚟咧，就係用咗 Trimix 之後咧，對 PE 係有所改善嘅，即係早泄嘅情況係有所改善嘅。大致上可以因為有兩方面幫助到啦。咁樣有心理嘅方面咧，因為用咗 Trimix 之後咧，佢哋嘅勃起嘅質素係比較持久嘅，同埋耐啲嘅。咁樣對佢哋造成嘅心理壓力咧就比較少啲。咁喺心理嗰方面咧就幫助咗佢哋好多啦。另外一方面啊，就係因為用咗 Trimix 之後咧，射完精之後嗰個硬度應該仲會維持到嘅。咁樣可以一路去更加多嘅練習時間咧， 就會延長咗射精嘅時間啦，有機會。